conversation with the DP earlier, it was in December.
It was in December,
right?
22nd.
Was now the one that reverted to the original agreement in the CBA.
Yes.
And you're saying that your members have confirmed that they received the proper pay in December and in January.
Yes.
Without delay.
Yes.
And now you're saying that the commitment is the arrears are to be paid in February.
Yes.
With the February salary or in February before the salary?
You know, the issues that we were actually striking for are things that have been, that had not been done for a while. For example, the intern issue was new. This one was the lowest we have been as a union, where the government just wakes up and reduces their wages.
Yep.
So it was a big thing for the union. And therefore, when you are suspending the strike, we wanted to see an evidence of a payslip that have reinstated the payment as per the CBA, which was done. So as of January, February, the payments have been reflected as per the CBA. But that was for the cohort that are already working.
Yep.
So again, when they were trying to bring that conversations in our meetings, we told them we can't entertain that because there's no any provisions that says employees' wages need to reduce, but they have been hell-bent on that. So that's why we are a bit keen. The other thing that we achieved also with that
this
strike,
was only for the cohort that were already in, not for any incoming cohorts.
That was the cohort that was in at that were posted in August last year. We did not discuss the fate of the current cohort that we have meetings with today. But essentially, the reality is that whatever direction court gave us, is that we have a CBA that is valid, and therefore there's no way the employer will come back and reduce the wages. And that's why we had a strike, and we were ready to go for another strike. The other thing that happened was there was this basic salary for doctors that had not been paid for 7 years. We had had engagement with government for 7 years and nothing happening. It led us to that 56-day strike. I think it is in December we was getting demanded that we were not ready for promises. We wanted to see the money in the account. And by the time we were suspending the strike, doctors in Kwale County were paid. And then the doctors in the entire country got 50% of the amount that was owed for 7 years in December and January. So
that's not to belabor, and maybe this has been covered. I just want to understand where the consistent delays are. What can you pin that on? Because 7 years of demanding something that's within right, and then having to constantly have some of it paid, some of it. Where exactly would you say is the major holdup when it comes to this main issue?
The biggest, and I will say that government or employers sign collective bargaining agreements with employees or with unions with no intentions to implement them. Whatever they always do is to handle the crisis at the time. It's not only with doctors, it's also with other unions. That's why if you look at the history of this country, CBAs are just being signed and put in the closets without implementations. And that's why as a union we say there's no need, there's no value in having a paper or document without having it implemented. And that's why we have always insisted that agreements that we had, yes, it's 2017, must be implemented in total before you ever sit down to discuss and negotiate a new document. So employers, government in itself, are just there to handle chaos. In fact, without strikes, like now, as I told you, you're going to have strike in Moi. Without that strike, nothing can happen. So
nothing moves.
Nothing moves. So if you're a union that can't strike or can't give notices, can't demonstrate, then you better shut down.